Blog Talk Radio.
Hello, folks. How you doing? It's Danny Tisdale, and you're listening to the Danny Tisdale Show. And we have Dr. Randi Nelson, who, I never asked her. I hope she doesn't mind me calling her Dr. Randi.
That's
but
fine.
okay, good. To, of course, give us updates on what's happening with the coronavirus, what we're calling at Harlem World Magazine the COVID crisis. And again, hit us up with a tweet, Facebook message, Facebook on any of our platforms at Harlem World Magazine, and let us know, your concerns or anything that you would like us to talk about in future shows or real time on this show. And as we've said before, Dr. Randi Nelson, medicine is her second career. She worked for 14 years in investment banking before deciding to give back to the community. Dr. Nelson earned her accounting degree from State University in Buffalo and an MBA from Hofstra, what I always have trouble with, an MD degree from Stony Brook in medicine. Her residency was at Jacobi Medical Center at Albert Einstein College of Medicine in BX, the Bronx. She is a fellow of American Academy of Pediatrics and a recipient of the Arnold P. Gold Foundation Award. Dr. Nelson was born and works in Brooklyn. And again, thank you, Dr. Randi, for being on the show. How are you doing?
I'm doing well. Thank you for having me.
As always, I am so glad that you are here, and this makes our third episode as we, I guess, speak every 2 weeks, you could say, about what's happening with the virus, what's going on, and all that good stuff. Any updates that you want to give us? I know that yesterday I looked at Governor Cuomo's, I guess you could say, press conference, and he mentioned that the numbers, there were 698,300 cases. There were 36,500 deaths. And he reported yesterday that there were 1,915 new cases. And I want to, kind of use that as a jump-off point. And I heard on another broadcast, not through Governor Cuomo, but that there were nationally only 1% of the population tested. Any response to any or all of those numbers?
Well, I think the deaths, I don't think it's as high as 35,000. I'm looking in the United States, we're at like over 30,000 deaths. New York City is like almost 9,000.
So I was giving, I'm sorry, what the governor was saying was national statistics. My bad.
Okay, great. Okay, no, okay.
Right,
I'm like,
right.
oh my God, did that happen in
New York City? No. You're in real big trouble with that.
Yeah, we would be real. I'm like, what's happened? But yeah, I mean, we see that the numbers are increasing. I don't remember. I don't remember what the points were. The numbers were when we last spoke, but. I mean, yeah, this disease is not stopping. The virus is continue to cause concern, especially, in certain cities like, New York City is kind of flattening a little bit. If you follow Governor Cuomo's
right, he said that
press conference, yes, it's starting to flatten. We may be at the apex, but we need a couple of more days. I didn't catch the press conference today, but it looks like we are at least at the very least flattening. Decrease in intubations, decrease in hospitalizations. Unfortunately, we are still seeing a lot of deaths. I mean, 600 that's a lot, considering where we started, like maybe about a month ago, a little over a month ago. So it seems like things are getting better. We are having these other places that are becoming hot spots, and I don't know if we can say that it's contained. It's still out there. We still have to practice social, distancing or physical distancing, everything that we've been taught up to this point. We have to continue to do these measures to prevent spread. I mean, Governor Cuomo extended pause to May 15th, I believe, and I guess he will continue to assess the situation as we get closer to the deadline. But it seems like physical distancing is working, at least here in New York City.
Yeah, and I haven't seen it, but I spoke to our creative director, E2 Evans, and he had said that he had heard that someone, an elected official, had suggested we distance ourselves even further than 6 feet apart. Is that something that you've heard, or can you confirm that? Or?
I've heard that. I've heard is, maybe 13 feet. I think everyone is still adhering to the 6 feet rule. But one of the new developments since we last spoke is that we are now mandated to wear masks in public, some kind of mask, cloth mask, some sort of covering. And now, if you go into some of the stores, like the supermarkets, or like I was just at the laundromat, you cannot enter any of these premises without having some sort of covering, because now, it's understood that we could pass the virus just by speaking or breathing. I mean, that easily. So that's one of the new recommendations that we now have to. I've been wearing a mask in public since maybe for the past 3 or 4 weeks, but now it's mandated that everyone, like, this is what you have to do. So I think that's that's probably the major change.
That until May 15th, it's mandatory that you wear a mask, and like you said, that it can be a cloth mask. It doesn't have to be anything more than that, from what I understood. And do you think, Doctor, that I'm forever the optimist, but I do like the facts. Do you think we will go past the May 15th date with the mask, or do you think there may be another layer of, do not shake hands scenario on top of that?
Honestly, I mean, I think wearing masks is going to be a way of life for us. Way past May 15th. May 15th is just maybe 4 weeks away. No, we're going to be, I believe we're going to be utilizing these measures for months, maybe into next year, because we just don't know. We just don't know. The course of this virus is new. We don't know if it's going to die down once the weather gets warmer, once it gets, becomes more humid. We really just don't know the course. Next year now, we'll have an idea, since a full year has passed. But right now, we really, it's still very, very new, and we're still, the community, the scientists, everyone is still trying, the researchers are really still trying to figure it all out. So I think that this is going to become a way of life. I mean, Dr. Fauci suggested that, maybe no longer shaking hands, which is really unusual. I mean, growing up in the business world, that you were judged by a handshake.
You just exactly.
What are you going to be judged by?
Fist pump or the
or
elbow pump, maybe, or whatever it is. Yeah.
Right. Exactly. Maybe we're going to be nodding. I mean, when I enter a room and I see a patient, first thing I do is shake parents' hand. Now I can't. I'll probably not do that anymore. because
that.
everything is just so, this virus is still so contagious, and we just don't know what the course is. Is it going to be like the flu, where, every season, we get into this particular time period where, influenza is prevalent? We don't know if it's going to be the way it is for the next couple of months at the same level.
Well, what do you, you talked about the next couple of months, and I've also heard that, when fall comes, we may end up having a restart, a second wave, right?
Yes.
What determines that, and what do you think about that?
Well, I apparently that's how pandemics work. I haven't studied pandemics enough to kind of, get the full gist of it, but apparently that's how it works. It's not just one event. It can happen several times, and I think we're kind of seeing that in the Far East. Last month, some of the countries like South Korea, Japan, even China had eased up some of the restrictions, and now they're seeing like another resurgence of cases. So I don't know if that's considered their second wave, but apparently that's how it works. Especially if the summer proves to be a time where the virus kind of dies out. If it dies out and then comes back when the cold weather
kicks back in. No, that's an excellent point, and that was some of what I kept thinking when I heard that. Well, they're waiting for warm weather to come, and then summer kicks in, and then right around the corner, is the winter. So much like you're saying, it's a big bunch of we don't quite know yet. And
it's still a big bunch of we don't. That's the scary part. So we just have to continue to buckle down and do what we know for sure will prevent spread. And that's like the social distancing, the mask wearing, staying away from vulnerable populations, just really keeping staying put.
Well, yeah, and I wanted to, I know that you are a doctor, and you're not a politician, you don't work in politics, but I know something that struck me, and I was surprised, but yet I guess a part of me understood that to be the case, but I guess I was really struck by the fact of something that I mentioned to you before we started, is much like libraries and the post office, the hospitals are not nationally linked to each other. Private hospitals, and then there's public hospitals, but I know that I think it's the NYC hospital, I know that's not the correct term, they're connected in New York City, but our hospitals nationally are not linked to each other, so we don't know what one on the left is doing or the one on the right is doing. For the most part, we only know what our hospital is doing.
Right,
Any comments about that, or do you think that maybe that we will at least consider thinking about linking them so that we can have a national plan?
But you mean in terms of tracking positive cases?
Yes,
or...
yes, so that, like Amazon.
Lovely.
Amazon, they can look at all the numbers of everybody who they work with, and unlike, the hospitals, the libraries, and the post office, everybody's kind of doing their own thing, I guess, from a state perspective or citywide.
Right now we're just, everyone's kind of relying on independent data from each city. I know for vaccinations, there's a citywide registry where, regardless of where a child gets, say, vaccines or so, I can look that up. But if they, if they live in Long Island, or if they live in Westchester, or if they came in from California, Georgia, I would have no idea. Something like that would be nice, but, you know, you also have to wonder, like, you know, if you have something like that for COVID, why are we using it? Is it for data? Is it for research? Is it, you know, what's the premise behind it?
Well, I guess I was thinking along the lines of something that, you know, the governor said yesterday is that, you know, having trouble tracking people who are coming from New York, from other states into New York State or New York City,
or vice versa.
And vice versa. You know, I know a friend of mine who's will go unnamed, lives in New York City. In his apartment building, 2 people died, so he, you know, left New York City to go visit his mother, but his mother is in another state.
Oh,
and
okay. So
on his own, he said, "Okay, I'm not going to go into the other state until." You know, something has changed, and it's safer to do it. Especially, if my memory serves me correct, his mother is over 85. So, you know, that's kind of his own
like working
way
on
of being quarantined, I guess.
Yeah, and being like working on an honest, being responsible. I really don't know how I don't know how that would be enforced. I don't know, you know, if you get into individual rights, you know, that kind of thing. Yeah,
because that's how we got here, right? States' rights.
Right. So it's I don't know. I guess for like I think something like that would be great for research purposes, but for practical purposes.
Gotcha.
You know, I know someone who went into Canada, who left New York and went to Canada, and he was like, he mandatory quarantine. Like, he had to stay in a place. Yes.
By way of Canada.
In Canada, and they tracked him. They were tracking him. So I don't know how, I just don't know how that would work here. But yeah, I know it's happening in other places.
Interesting, and that was the other thing I kind of felt, and as I spoke to other people, is that you know, dare I say it, that it seems like as time passes and progresses, I almost hate to say it, that I feel less and less that we're feeling like a world power, you know. Especially when we've got to get everything from China, you know, the very place where it started. You know, it's like we've got to buy masks from them. Nothing against China.
Right. No, I understand. But, you know, we are a global society. We are a global economy. And the thing with this is you know, the economies, you know, especially here in the United States, shut down because of the virus, because of the spread of the virus. It has no boundaries. It doesn't know boundaries. It doesn't know state lines. It doesn't know borders. And as we, you know, as we continue to fly and travel and go to different countries, and then there's always going to be kind of like that risk. I just don't know how, I don't, in terms of,
what that,
you know.
No, I was just going to say kind of what that change, or, you know, what that looks like. And I don't either.
Right,
but,
exactly. I don't know how that, because I don't know if, I don't know, like, if okay, say if we got all of our masks here, or manufactured all of our masks here, would it have made a difference? Yeah,
difference.
I don't know. Yeah, I don't know. I think it's because of, you know, everything stopped because of self. You know, manufacturing stopped because of the, you know, the infection, or, you know,
the virus
not just
itself.
Right. Yeah, right.
Right. Well, you know, Randy, I know I'm Dr. Randy. I know I'm putting all this pressure on you to answer all the questions that Dr. Fauci couldn't answer and that the president couldn't answer. I don't know why you can't answer them, but why?
But it's the thing with this virus is we've never seen anything like this before. I mean, we just never. So we're still. It feels like we're still we're setting precedents now. We're still trying to figure out how to move. It's really interesting, and it's interesting to be in it and watching it all play out.
Yeah, it really is, and I want to get back to that a little bit too and talk about the future. But I want to just let our listeners know they're listening to the Danny Tisdale Show, and I'm Danny Tisdale. It's on Harlem World Radio, and Harlem World Magazine is independently owned company, so please hit the orange patron button at the bottom and become a patron. And I want to get right back on track with you, Dr. Randi. And I think you're right, is that we're in the middle of it. And because I'm a futurist and I love crystal balls, is there anything that we can learn from this? You know, if we kind of, press the look into the future button?
Well, definitely look at what went wrong, what went right. I think what went wrong is not being prepared, especially, when we knew that there was a good chance that it would spread here. There's no reason why hospitals have to be scrambling for gowns and masks and, that going forward, there should always be enough of that items to access because this can happen. This can easily happen again. So that's what wrong.
Too easily.
But too easily, right? So making sure we have access to ventilators and making sure we have what we need should this happen again. And then look at what went right. We know that social distancing, physical distancing is something that works. We know that, doing certain procedures work. So, and the good thing is that it won't be new, God forbid the next time, because everybody will understand, everyone will know. But I think everything, I don't know what it was like in 1918 when there was the flu pandemic. I don't know how, of course it was a whole different time, but I think we should just really look and learn and see in this and really study. And I'm sure we will. I'm sure the officials, I'm sure researchers, I'm sure elected officials are going to look at this.
Yeah, and I completely agree with you, and it's a little scary and intimidating, and yet I think you're completely on point. Is that we will learn from this and be better prepared the next time around. And I wanted to ask you a question. I heard a term that I hadn't heard before, and is there such a thing that doctors and hospitals use called acceptable loss?
Oh,
you know what that term means.
Yeah, I don't like that, and I've been hearing that a lot in the past 2 weeks, and it's. We don't go into medicine with the expectation that we're going to lose individuals. That's not. I love
that, doctor.
No, I mean we really don't. You just
no.
don't.
I love
and
that.
It's just you just don't go into it for that. Even if if you have someone who have no chance, you still try. That will never sit well with me ever.
And I know our listeners know what that term means, and there might be one or two that doesn't. I mean, you know it better than I do. How do you define that term?
Well, basically, in terms of what I've heard in the past couple of weeks is that, we should be okay with losing a certain amount of people.
Right.
We should,
right.
We should, in order to move forward, we should be okay if, we lose 1% of the population
right.
or 2% of the population, so
right.
that we can move forward as a society in different aspects. But that's a position that doesn't ever sit well.
I really, again, love your response and that statement to that, which is that's unacceptable. And you didn't say it, but I get from that's, for me, as I paraphrase it, is that's not even something you think about. To me, that's
not.
Your response is like that. It's like okay, that's not even acceptable.
Foreign. Yes.
Yeah.
Yes.
That's just not even the way to think, and I love that because it's like being open to the fact that you will lose, or that somebody, we have to accept that, our uncle or our aunt has passed, and that's acceptable, and that isn't acceptable.
No, it's not. Yeah,
it never should.
I'm. We're talking about it, and I don't have a great feeling, like physical, like feeling. No. Mm-mm.
Yeah,
that's not what we're going.
Right.
It doesn't matter whether age. I mean, this has been tough. Like in certain countries, there's been some tough decisions that had to be made in terms of who gets a ventilator. At least that's what's allegedly occurred, like in some countries, like in Italy. But no, you want there to be enough, and that's why that's why officials. This is why we keep pressing the fact: do these things, be inconvenienced for a little bit, so that if someone should need hospital services, whatever that may be, it'll be there for them.
Right. And another good point that you brought up that, we have to be inconvenienced to hit our goals sometimes. And if that goal is to stay alive for the greater good, that's what we do. We make those sacrifices for each other, and I'm not going to call out any names or states, but I know that there are some people in some states and cities who, are picketing to say that, we want to have the right to go to the beach or to, have a party and let's remember who we are and that we are here for each other as Americans. And
we're doing it for everyone's protection, not just certain people. It's for everyone, for everybody.
Yes, and I just want us to remember that, and Dr. Randi Nelson, thank you for the work that you're doing, and
thank you.
I could tell there was a little turn made, and maybe it's because you're. Oh, tell us before I got. Of course, we're at that moment where we've got a minute left. You talked earlier about telehealth. What is telehealth?
Okay, so what a lot of practices have been doing, especially like mine, to kind of prevent patient flow into clinics or private practices or hospitals, really is to kind of have visits, and these are real visits, via video or via telephone. So that, someone who they say, well, I got a little rash. How do I treat that? So as opposed to coming into the clinic where they may be exposed to, say, like a COVID possible case.
Doctor, we got 30 seconds.
And we'll take care of it over the phone or video.
Got you. And that's what you're doing now. And, as the clock flies, as it always does, thank you for being on the call as usual. And folks can go to cdc.org. And I'll be reaching out to you again so that we can do this again. And hopefully we have lower numbers the next time that we
That'll be great.
speak. It's always great, Doctor.
Thank you.
Okay. Take care. And
bye-bye.
Please be safe. Bye-bye.
You too. Bye.
And thank you, listeners, for listening in. We'll be back to give you more information. Talk to you soon. Bye-bye.